be careful. I don't want to hit the corner of the bed. Those are one of the things, or I don't want to get scratched because it's going to... for it to heal.
To pay special attention to their feet because over time, high blood contribute to neuropathy or lung. One noticed. Avoid putting unnecessary pressure on your feet. Pressure is the main cause of skin breakdown. With each step you take, your body weight shifts and is supported by different parts of your feet, creating pressure points. These pressure points, which are normally in your heel, the ball of your foot, and your big toe, are the areas where your skin is most likely to develop blisters and calluses. However, the shape of your feet changes over time, adapting to the way you walk, your health, different shoes, and other demands you place on them. These changes may include the development of bunions or calluses, which may shift the pressure points on your feet. Your footwear needs to keep up with these changes, because properly fitted footwear is your #1 defense against pressure and skin breakdown. When shopping for shoes, choose ones that support your entire foot, and yet are wide and long enough to give your foot plenty of room and relieve pressure points. Leather shoes and athletic shoes are good choices. Specific guidelines to keep in mind are a toe box that extends 1/2 inch beyond the end of the toe, a heel compartment snug enough to prevent slipping and rubbing, but not so tight that it creates a pressure sore, a soft absorbent liner, and a heel of 1 to 1.5 inches or lower. Every time you buy a new pair of shoes, have your feet measured and try on both shoes. The best time to buy new shoes is in the afternoon. Feet swell during the day, so if you buy shoes in the morning, by evening they may be too tight. If you have a hammer toe, bunions, or corns, or are flat-footed, you may be advised to see a podiatrist, a doctor specially trained in foot care who can prescribe a shoe that meets your needs. Or you may need to see a podorthist, a footwear specialist who can create a shoe to accommodate the unique shape of your foot. Another way to protect your feet is to not go barefoot or sockfoot, even inside your house. Slippers may be appropriate at times, but they too should cover and protect your entire foot. As we've said before, high blood glucose over a period of time may cause neuropathy, a loss of feeling in the feet and legs. This means that you can't feel when there's a stone in the bottom of your shoe, when you've stepped on a piece of glass while going barefoot, or have a splinter in the bottom of your foot. So you may not notice an injury or infection until it's too late, which may lead to amputation. That's why it's so important to examine your feet every day. Develop a daily foot care routine. Check for redness, flaking, calluses, dry skin, or cuts that won't heal. If you have trouble seeing the bottom of your feet, you may need someone else to help you. Examine your toenails and keep them trimmed. They should be shaped to match the shape of your toe, and rough edges should be smoothed with a nail file. Once a day, wash your feet with mild soap and warm water, and pat them dry. Then moisturize your feet, but not between your toes. Check your shoes for any objects before putting them on. If skin or foot problems do develop, don't try to treat them yourself. That includes using over-the-counter products for cords, calluses, or ingrown toenails. These products may only worsen the problem. And under no circumstances should you use sharp tools such as single-edge razors to dig out ingrown toenails, or shave down calluses, or perform any other kind of bathroom surgery. To help prevent foot problems from developing, wear a fresh pair of socks or stockings every day. Choose ones that keep their shape, absorb and draw moisture away from your feet, and don't have inside seams or tight-fitting elastic bands.
Since I don't have a very good feeling, I check them to see if I have any sores or any red spots or anything like that. And so far, I've been successful.
Whenever you go to see your doctor, take your shoes and socks off and make sure the doctor examines your feet.
People with diabetes need to pay special attention to their feet daily. If you have poor blood glucose control, you may increase your risk of losing feeling in your feet or legs. Do you check your feet each day for redness, flaking, calluses, dry skin, or cuts that won't heal? Do you keep your toenails trimmed? Do you see your doctor or podiatrist for a thorough foot exam every year? Take some time to go through your closet and get rid of shoes that are too small, do not provide enough cushion for your feet, or put too much pressure on parts of your foot.
Effective diabetes self-management also requires looking beyond the present, toward the future, and maintaining your good health. Your skin provides you with an important defense against infection, but only when it's healthy. High blood glucose can cause skin breakdown, such as dry skin, rashes, and boils, and can promote the growth of some bacteria. You can help prevent these problems by following these guidelines. Keep your blood glucose within your target range. Drink plenty of fluids to keep your skin hydrated. When cleaning your skin, use a mild soap, pat dry, and moisturize. Before you get into the shower or bathtub, check the water with your elbow first to make sure it's not too hot. To avoid trauma to the skin, use sunscreen and try not to scratch insect bites. These common sense steps will help prevent the potentially serious problems caused by skin breakdown and infection. People with poorly controlled diabetes may develop retinopathy, which is a disease of the small blood vessels in the retina of the eye. It's important to see an ophthalmologist yearly for a complete eye exam, which includes having your retinas examined through dilated pupils. This test helps to diagnose problems early so that they can be treated. Keeping your blood glucose and blood pressure in a good range helps to delay or prevent the onset of eye complications. If left undetected and untreated, eye problems can lead to serious consequences, including blindness. People with diabetes are more likely to develop gum disease because they have more plaque, which may be caused by reduced saliva, high blood glucose, or poor circulation. Gum disease makes it harder to manage diabetes because oral infections may raise blood glucose levels. And if left untreated, gum disease can lead to tooth loss. To avoid these problems, brush at least twice a day, using a soft bristle toothbrush for at least 3 minutes per brushing. Floss at least once a day. Make an appointment with your dentist if you see red, swollen, tender, or bleeding gums. Seeing your dentist every 6 months rounds out good preventive dental care. Getting immunized for flu and pneumonia helps to prevent sick days.